The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Please write in your questions early. I want to start with the question that Joannie wrote in. She wrote in a bunch of information, which I'm not going to share here, but I've shared it with Dr. Granpeesheh, giving us all the backstory about one of her children. Joannie, if you're watching, we see that the GFCF-EF, and I just want to make sure what the EF is. Is that egg-free? I've seen GFCF-SF for soy, but I don't know that I've ever seen EF.
And corn even, yeah. But
yes,
I've not seen, yeah.
But let us know if that's it. And she told us a little bit about the fact that he's taking daily vitamin, fish oil, pre and probiotic. But now, after egg-free, thank you. We thought that's what it was, but we wanted to be sure. But now, after having gone to 2 TACA conferences virtually, and it's a game changer when you do that, they want to step things up. And so their first question is recommendations about weeding through doctors to find the right one. The second question is, I feel like we should start this process with blood work or testings to find out allergies or sensitivities, not to mention deficiencies. Am I right to think that $2,000 is a reasonable budget to begin with? And they said thank you, and they're sending love and blessings as well.
Yeah.
We love you.
Thank you for that, Joannie. Yeah, I don't recommend, so I think that you start by looking for the doctor, right? Yeah. And I think it would, go on MedMaps. That's where I would start. Yeah. And I would start looking through the doctors. There's practitioners on there. There's also dietitians, nutritionists, and so on. I would probably at this point, since you kind of want to do an overall view of things, I would want to make sure you're looking for a doctor, so MD or DO. And I think the way to choose the doctor is just to have a conversation with them. Yeah. So I think you would call them up, set up an appointment. First of all, that's a good test because some doctors are so busy that you just don't get time with them. And I think it would be important when we're talking to functional medicine doctors, you need time because there's a lot of stuff that they want to explain to you and you need to understand and so on. So make sure you have that conversation, and if you feel comfortable and if you feel like this is someone who kind of understands things the same way you do, that's, I think, the most key thing because just like, for instance, in ABA, there are ABA professionals who will tell you, don't do anything medical. There are also physicians who will tell you, don't do ABA. So you want to make sure you have someone who's thinks about things the same way you do in terms of all the things that you've done and are doing. And you just want to have that rapport. You want to have someone who's going to be on your side and not being critical of things that you've already done. I always say parents know their kids the best. Look at, after all these years, you're going to TACA conferences, which I think is amazing. And so make sure it's someone that you feel comfortable with and ask them a lot of questions about, so what do you think about this? What do you think about that? I'm doing this. This is his history. Like, spend that time, right? And usually, and it depends. Some of these physicians are so busy and overwhelmed that they don't have any time to spend with you really, but I think try to force that initial conversation. I think is really important. And by the way, it doesn't have to be someone who's a MedMaps physician. You can also look up functional medicine, and actually you can even look on your insurance policy or your insurance website and look for functional medicine physicians, call them up and ask if they have any expertise with kids on the spectrum, because there are a lot of those folks who don't necessarily go the MedMaps path, but they do know what they're doing. So that's your step one. That once you get in and talk to the individual and actually they do their first initial eval, they will tell you what kind of blood tests they want, blood, urine, stool, etc. And it's So, the doctor has to decide exactly what they're looking for. It's not always going to be with something comprehensive. In fact, you might have had some testing done in the past year that could suffice for some of it. So just don't work on the blood test or worrying about that until you actually find the physician. 2,000, I think, is going to be a little low.
Yeah.
From what I understand, a lot of these physicians, their first full eval is closer to 5,000. And if you need help with that, apply to, excuse me, our nonprofit organization, Autism Care Today. We do fund up to 5,000 for whatever a parent or child might need. So apply to that and maybe shoot an email over to Shannon, and she can also put in a good word so that we can try to get you some help with the funding so that you can get the ball rolling.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.